Now we're going to turn our focus to the perspectives of older people receiving aged care and what the new Aged Care Act and the strengthened quality standards mean for them and to them. And so let me invite our panel now onto the stage for this session. First of all, Commissioner Janet Anderson will be joining us again on the stage, but joining her on the stage is Craig Gear OAM, Chief Executive Officer of OPAN, the Older Persons Advocacy Network. And joining by Zoom is Pat Sparrow. Pat Sparrow, Chief Executive of COTA, Council on the Ageing Australia. Now, Craig was appointed CEO of the Older Persons Advocacy Network in 2018. He has a Master of Nursing in Critical Care and over 20 years of clinical and senior management experience within the health and human services sector, previously serving as board chair at Seniors' Rights Service. And he's committed to connecting and improving the health system for all Australians, and has been using his experience to drive better outcomes for at-risk communities for more than 20 years. Pat leads the peak body for older Australians, taking a very constructive approach to building an inclusive and a positive future for older people. Her goal is to eliminate ageism, which, as she says, should be as socially unacceptable as sexism and racism. Committed to building a more inclusive Australia that values the contribution of older people, Pat's career spans community, disability, aged care, health and advocacy roles. She has experience from the perspective of not-for-profit, public service, advocacy, ministerial office, and perhaps most importantly, as a support to her own ageing family members. And Janet is going to take over now to facilitate this discussion. So as I hand over to Janet, will you please welcome our panel?
Thank you, Richard. Good morning, everyone. We've had a very strong start to today's proceedings, so no pressures, colleagues. We'll see if we can continue the lift. I actually want to answer the last question that Michael was given as well, but I'll move on and resist that temptation. We don't ask you to document too much, but we'll come back to that. In this session, I feel very strongly about that. In this session, I am delighted to be joined by two colleagues, Craig and Pat. We spend a bit of time together, and indeed, as recently as last night, Craig and I were talking about some of the matters I expect we're going to cover today. The point of this discussion is to explore through Craig and Pat's work with their respective organisations and in the engagement they have with the broader community and particularly people, older Australians and also people who represent them, exploring what the new Act means for the delivery of person-centred care to older Australians both now and in the future. And many of you would know Pat and Craig and their respective work. They have actually spent some time recently going around the country, they and their representatives, listening to members of the community, to older people, and taking a sounding from them on what they think about, whether they know about, but what they think about the reforms which have been implemented and are coming, and also to the extent to which it gives them confidence or something else in aged care overall. And I think we will get to hear a little bit about that in the course of this discussion. The Commission has also been very energetically engaged with older people. We have a Consumers and Families panel, which gives us access to over 300 individuals who are either recipients of aged care or represent those interests. And we use that group extensively to audit our own products, to check our thinking on the way in which we engage with older people across Australia. And they have been vital to developing our understanding of the presentation of information, but also what information is most useful to people as they consume or seek to consume aged care. We are also doing some really important work in relation to subsets of the community. We have a specific reference group now on First Nations people. We're very pleased to have as a new member of that group, the inaugural group, Andrew Kelly, who's here today as the inaugural Aged Care First Nations Commissioner, which is just great. We also are looking at doing additional work and in the early stages of working with the group on culturally and linguistically diverse consumers and also providers, and trying with greater clarity to hear their voice and understand how we connect with them and appreciate their story and what's important to them. This session today is neatly positioned between the work we did with many of you in the workshops on Tuesday, where I actually chaired a session on hearing the consumer's voice, which was fantastic, and certainly the Commission gained a lot, and I think the people in the room enjoyed and appreciated the experience of sharing their stories. But also the work we're doing later today in understanding the role of governance, and particularly boards and the governing arrangements, in ensuring that the consumer's voice is front and centre in the decision-making process and the way they set priorities and set their course of direction, their course of action. So, there will be time for questions. We will make sure that we let you into the conversation, because I am sure that all of you have something to contribute. But in the first instance, I do want to give some time to Craig and Pat. And my understanding, Craig, is that we're starting with a video that you and Pat organised to produce. Do you want to introduce it briefly?
Sure. Thanks, Janet. Acknowledging the Kaurna people and thanking them to allow us to meet on their lands today. And this was, I suppose, important. Pat and I saw that it was really important to have the voice of older people in the room here today as well. We saw a little bit of that yesterday in the video, I think, that Lisa had put together. And this is a theme I'm seeing grow and emerge through aged care. We've seen it in the mental health space when I've worked there. We've seen it in the disability space. Our older persons reference group at OPAN constantly tell me nothing about us without us. And partly this video today is really to bring their voices into the room, but for them to say what they're looking for from aged care and what a positive experience of their rights being upheld, what it would look like.
My aged care experience would make me happy if a service provider was meeting my rights. They've listened to what I want. They're giving me the services that I want, and they're high quality services and cost effective services.
My experience would look quite different, and that I would be able to do short courses, learn new skills, and experience more social interaction. I would feel far more fulfilled in my life.
But when they're upholding your rights, day-to-day life is enjoyable. All my decisions about me come through me. I'm the one who's consulted. It's important to remember that I'm still a person and I still have the right to make my own decisions. I like to make my own bed. I like to get up when I want to get up, all that sort of thing. So you're allowed to, within reason, you're allowed to live the life you want to live.
Your dignity is safeguarded all of the time in every way. The staff are absolutely marvellous in most applications, so much so that I consider 3 or 4 of the staff to be part of my extended family.
It would look like or feel like as though somebody cared, as though I had really got their attention and that I was not a commodity. That just meant dollars. Mentally, I would not be stressing myself. I mean, I'm in my late 80s, turning 90, and I think, oh, Jennifer's, how will I cope then? Will my mental ability still be okay? Well, I want to know that I've got somebody who is going to see me through that.
Well, an aged care home should feel like a home. You're working in their home. They're not living in your facility, it's a home. And that's true, that's what it is. We live here. And it should be respected as our home.
And that I'm treated with respect always. Respect in the design of the package, respect in the delivery of the package. As an older person, I'm still a person. I still have value as a person. I still have human rights as a person. And I am not a disposable character that you just need to do X, Y, and Z. Tick the box and off you go.
Yeah. It's a very powerful set of statements right there. If I can start proceedings, Pat, with you, and this, it will be difficult to do in summary form, but if you could take a grab from what COTA and OPAN heard as you did around the country tour, what are some of the key themes that you were hearing when you asked people, do you know about the reforms? What do you think about the reforms? Are you optimistic about the future? What is your level of confidence and what would you like it to be? What did you hear? Can you grab something for us?
And I'd just like to say good morning to everyone and apologise for not being there in person. I'm a NOVID no longer. I got this far through the pandemic without having COVID. So the only thing that prevented me from being there in person with you all was the fact that I've got COVID, but I'm well on the mend and very pleased that I was able to join this panel today because the topic is so important and so dear to my heart. So I'll try and do a grab. I was trying to see if I could come up with a fancy acronym actually for you, Janet, this morning, because I'm feeling better and I'm feeling a little bit bored at home. But I couldn't. But there are three things that I would say were common in all of the conversations that older people said to us around the country, but also when I talk to older people generally. And actually also when I think about myself or any of my contemporaries or anybody at any age about what things actually matter to them. And I think this is an important thing for us to think about. The first thing is respect. People want to be respected. That was a really common theme across all of the conversations. They want to be listened to. They want people to listen to them, to really listen to them, not do what we often do when we're having a conversation, listen because we're getting ready to what to say next, but to actually listen to what's important to them and to believe them and to take action on it. Those are the things that really came through as the themes. And Janet, I think you touched on confidence. I think there's a positive feel that there's a conversation about rights and about changing the system. But the confidence is a bit ish. They've, older people I'm talking to have heard some of this talk a little bit before, or seen some positive signs, or seen things being developed and talked about, but they're not really implemented. So they think a change is coming, they look forward to it, and then it doesn't quite pan out the way that they were thinking it's going to. So I would say there's an ish confidence about it, but I think those themes are common across the conversations we've been having.
Oh, thanks, Pat. Thanks for that opening. Craig, I see you nodding. You have the similar sense?
Yeah, it's interesting because we've heard it as we've gone around the country. I've also heard it from people like Leslie Foster, who's a home care recipient in rural WA and is a member of the ACPA Consumer Advisory Group. One of the topics that Leslie wanted on that agenda for ACPA to consider was broken trust. And it's kind of been a bit of a theme through yesterday, and some of your words yesterday was around how do we build back trust? And I'm no Dr. Phil, but I went and sort of had a look and was like, how do you actually earn trust? And it is about the words matching the actions or the actions matching the deeds. And so there is something about this, about why is the confidence? We've done all this work, there's been lots of investment. Michael talked about all these great initiatives and also the really hard yards that aged care workers and the providers have put in place to get us to 24/7 nursing, more minutes, but the trust is still having to be built back. And there's a number of things that we can do to do it. the Rights-Based Act, the positively upholding those rights, but there's probably when things go wrong is what we do then. That's when the rubber really hits the road then.
Okay, a lot of talk about Rights-Based Act, and that has been the language that has been used by the government and by people generally when they talk favourably and in anticipation of better when the new act is introduced. Let's unpack Rights-Based Act, and you and I were talking about this briefly last night. It can confuse, it can be understood in different ways, and for some providers, and I've had these conversations with some providers, they are very insistent that rights come with responsibilities and you can't consider one without the other, and this is going to get very chaotic very quickly. Now, that's not an illegitimate view, but I think it speaks to a bit of muddled thinking that we collectively need to work on together. Craig, I'm going to start with you and then come to Pat. Unpack that a bit for us, would you?
Yeah, I think importantly, we've all got a piece to play in this. Our aged care advocates, us as consumer organisations, empowering older people with their families as well, to stand up and say, hey, family member, this is what I actually want, and you need to respect that, and don't come in and take over, which we know often happens. But I take myself back to 2019 when Daniela Greenwood, who works a lot and has been working with Mercy Healthcare in the past around this area, she played a video to me of this nurse coming into the room and saying, come on, time for your shower, get up and that. And it actually brought me to tears because that is what I had done so many times in my nursing career, of just walking through, and it was about the task, it wasn't about the person, and it wasn't about that. So simple things that we can do in taking the myth away about this is about thinking about the daily interactions, those simple things that we do that's going to uphold the rights. As a nurse, I have that power. That power is over the person to get them into a shower, whether they have a shower or not, or whether they get to lie in because they've been watching Netflix last night and they really were interested in that. So this is about, and this is why we're really strong about not the mutual responsibility so much, because we have to shift the power dynamic. We have to bring it back into a more balanced relationship. That's what older people are telling us that they want, and we know providers can do it, and we know that they do it. It's almost getting that into our DNA. How do we do that the power dynamic's more balanced? The responsibilities, the mutual respect for rights will naturally flow from that.
It's a nice way of conceptualising it. Pat, what do you want to add?
Yeah, look, I couldn't agree more. But there are a couple of things I think to draw out, and that is that there aren't many times where I, as an adult woman, would think I didn't have human rights. And so it's a little bit of a shock for people to think that in aged care they don't necessarily have the same level of human rights. Now, I know that a lot of people in the room wouldn't think that's right, but you need that fundamental underpinning and understanding to ensure that human rights are enacted. One of the things that I really do think underpins some of this thinking is ageism, and I do need to talk about it. And I want to touch on three types of ageism really, which is that we all have our own internalised ageism, and what we see with that is that we limit ourselves and we place a limit on ourselves about what we're going to do. So we all do that to a certain extent. What we see play out in care settings quite often is benevolent ageism, not just aged care, in health, in a range of areas, where we put assumptions on another person based on their age. And there were some good examples from aged care recently, which possibly underline some of the things that Craig just talked about. The work that the Human Rights Commission actually did in doing some training in aged care on human rights, with staff who initially, before they did a workshop, said that they were not ageist. They worked in aged care because they loved older people, and they weren't ageist. But at the end of a 90-minute training session, they started to talk about the fact that actually they were ageist. And one example that stuck with me is the woman who said, I realise now that I yell at everyone because I have determined that because they're a certain age, they can't hear me. So I'm yelling at all of them rather than actually spending the time to think about and find out, is this person able to hear me? Do I need to be able to speak up? Do I need to stand in front of them so they can see I'm speaking to them? So I think that there's that kind of, we know what's best for you, benevolent ageism that underpins it, and in a way takes away from people's rights. And then we do know that there is systemic ageism, and I'm sure that some of the topics around dignity of risk, etc., and I know that's a difficult topic, but some of those things would probably come through. So I think the question is, when should you not have human rights? And it's certainly not at any time, and it's certainly not when you're in aged care. And how do we make sure that ageism doesn't underpin our own, in the way that we act, but also the way that we view and treat people and respect, listen and act on what they say?
I think what both of you have illustrated is that when you ground the idea, the abstract concept of rights in the reality, in the lived experience of both the older people and also the staff who are interacting most often with them, you actually have a bit of an aha moment, don't you? You say, oh, I get it now. Yeah, this kind of makes sense. And if I were to put myself in their position, I walked in their shoes, that's exactly what I would want and expect. And it would allow me to be respected as an individual with preferences and goals and values all of my own. Pat?
Because, Jana, a useful thing to think about in that space is that actually, if we're lucky, we are all an older person waiting to happen. So some of us might be closer to it than others. Some of us might be closer to it than others. But I don't know, and I've not met any older person yet. And I'm 60 now, so I classify. I'm not all of a sudden, there wasn't a click of the finger where the things that mattered to me no longer mattered, or I would be really happy for someone else to make a decision or assume they know everything about me. There is no magic moment where that happens. And in fact, when you talk to older people, they talk about how they, get a shock when they look in the mirror and see that they're 70 or 80, or they get a shock about all of the things that have happened in their life. So I think it is precisely that, and not othering.
Yeah.
We don't, when we turn a certain age, we're not all of a sudden somebody else that is not recognisable. And I think we have to recognise that in ourselves to be able to recognise it in the people that we are there, ultimately to support.
Craig?
I go back to what Rosemary said then in the video. For me, someone making my bed, when you see how messy my bedroom is, would be great. But getting to know what Rosemary's wishes and preferences are, it's a pretty simple thing to know that, how do we get to know what this person, who this person is, but what they want. Rosemary wants to make her own bed. That should be easy for us to do. But we've got to take the time to get to know people's wishes and preferences.
And also, in taking us briefly into a far more complex discussion, where the individual wants to do something which is utterly dangerous and almost life imperiling, the ways in which you negotiate that conversation. I mean, there's the dignity of risk, Pat, that you've raised, and we often hear the oppositional statement, there's dignity of risk and duty of care. Well, I think that's a fairly sterile opposition, and I think you need to push past that and understand individuals, as you say, as you find them, where they are in their lives and the way in which they want to be supported to live their best life. But I think what you're implying in some of what you were saying, Craig, is that it's not about taking the person and everything that they present, and that's what has to happen. Like every relationship we have in our lives, it's a negotiation, isn't it? I will come to understand you and I will respect you as an individual with individual choices and agency, and I would like you to do the same for me. And let's have a talk about why jumping off the roof probably isn't the best choice you can make, but we might see what other ways there might be to get the adrenaline shot. Let's have a conversation about this. I hear you. I understand your appetite to take a particular risk. How can I help you exercise that choice in a way which is going to keep both limbs intact? That's the conversation. It's not your rights, my obligations. It's your rights, your expectations. Let's talk. What can I do as a care worker to assist you in realising that ambition for yourself in a way which is going to keep you broadly free from harm? Great.
Yeah, and in life there's always trade-offs, there's always negotiation. That has been the collective sort of the statement of rights coming into the new Aged Care Act. The right for pets, if everyone wants to have every pet and Noah's Ark and it's all going to be in there, it ain't going to be the way it's going to be. But there will be discussions about how do you facilitate that. If someone has got a connection to a horse and that sort of thing, maybe people going out and staying connected to their community, that's their right as well. It's going to take negotiation. It's going to take discussion. That's probably the biggest thing, is the discussion about what's important to you. Gwenda has talked to me, Gwenda Darling, who's on our reference group and does a lot of work and is on the Council of Elders. And she talks about even just in the daily care. Have you sat down and talked to me about what do you want to achieve this week? What do you want to get out of this home care experience? What's your priority? And that's the challenge. And doing that is upholding people's rights. Simple as that as well.
Okay. Question without
No,
notice.
I would just add to that, you know, with a personal experience with my mother, who told me that the thing that would have made the biggest difference for her experience with an aged care service was if someone had sat down and taken the time to talk and listen and then acted on what she said. I mean, all we're really talking about is, you know, conversations, asking questions, and supporting someone. And I mean, I think that's the fundamental basis of what the big shift is going to be.
Yeah, and that's one of the biggest things that come through to our aged care advocates, 37,000 cases of support last year, and that's the biggest issue. No one listened, they didn't communicate. If we could get that right in aged care, it's a fundamental part about building back trust.
Yeah, I had my father had a friend in aged care, and she was made resident for the day, and I know numbers of you have programs which are similar than that, and she had a wonderful time, and she said the biggest bonus of the entire day was when someone came to her and asked, what can we do which is going to make a difference to your life today and going forward? And she said, if you could move the clock on the wall so I can see it from the bed. And I thought, she had to wait to be resident of the day before she felt she was able to have that conversation. It goes back to the power dynamic question, doesn't it?
It does, yes.
Understand the individual. Pat?
Yeah, no, I think to your point about, you know, when we talk about some of these things, we automatically go for people who are going to want to go skydiving. It's often much simpler. It's often much simpler than that, like move something so I can see it, or, you know, so I think this is the importance and the power of having a conversation and understanding who the person is and what they're wanting to do and how they want to live their life. It's unlikely that you're going to have all of your residents or all of your home care participants wanting to go skydiving or jump off a roof.
Indeed, one trusts not. I'm going to ask a question without notice because that's what I do. And each of you will have a view about this, and you're talking to a room full and live streaming to numbers of providers, and there will be different perspectives on this, but I'm intrigued to know what you think. There is the leadership that's required at a whole of organisation, whole of service level, which establishes this as the expectation going forward. But then there are the skills and techniques and the awakening, if you like, the realisation by individual staff that this is a better way to go, that the nature of this interaction, getting to know the individual, pausing with them, even though you're time poor, to have those 2 or 3 sentences conversation, which are going to make such a difference to that individual's sense of being seen here now. What's your view on how much of it has to happen from the top and how much of it can come from the bottom, where individual staff are motivated to make a difference in people's lives? Craig, do you want to start?
It has to be both. It also has to be working with our services coming in and helping people and helping train people as well in this. The work that Marie's done, and acknowledging Marie here today and her last day, but having done the virtual reality dementia training, when you walk in someone else's shoes or you see it from a different perspective, boy, that is powerful. And does that make you go, aha, back to the aha moment? So we actually need to get some training in for our frontline workers, because that's the day-to-day experience where Margaret, as she said, it will make me happy. But it's why I suppose we're so passionate about this Rights-Based Aged Care Act and getting the Statement of Rights legislated and enforceable and upheld for when things don't go quite to plan, because it is going to shift. It's going to shift. It's going to make a more enjoyable interaction between aged care worker and that. And the times I've seen this really done well, a friend of mine was a home care worker, and she was there working with a Greek gentleman, and she sat there and worked with him, and he wanted something that the family didn't want, and her to go in and advocate for that, because she was going, we don't have to do this. Wait, that. And she went and she then negotiated with the family and said, he told me this is what we wanted. This is what's documented in his care plan. This is his right. Let's go and do this. And that made for a much more balanced power dynamic, but also a better action for the older person, better action for the worker as well. But we've got to train people in that.
Okay, so training's fundamental, and I don't think there'd be any disagreement in the room about that. Pat, top down, bottom up?
Yeah, it's both, but I think that we know that people will model and copy what they see leaders doing. And so, it's really, really important that those of those people in a leadership role are setting the right tone. And I think we only have to think back to what we learned through the COVID pandemic. And I know that we don't really like dwelling on that. I certainly don't remember very much what I was doing at that time. But authenticity, spending time with people, showing yourself to people, doing all of that stuff as a leader through the COVID pandemic is what made teams stronger and what got people through. Certainly was the case with the team that I was leading at the time. It was really important to model and to do that. And when I said that I was having a bad day and needed to go back to bed and pull the quilt over my head for an hour before I got up, it made it okay for other people to do it too. So this is going to be the same change. If you as a leader are saying it's absolutely necessary that you spend time, you ask questions, you do all of that, and you think about things differently and you model that, staff will take their cue. And you're right, there are staff who will naturally do it, but they'll still be looking to see, staff will still be looking to see, is it serious? Do they really mean it? Or are they still going to be checking on, have I done X, Y, Z within a set time frame? And I know that there's going to be those struggles, but it has to be led from the top to give people permission and to change the culture. And that's what we have to do, is change the culture. People want relational care, not transactional care. And that's kind of where it's unfortunately sort of got to.
And the other thing I think the leadership team can do at the facility level, but at the governance level as well, is make sure that their restorative justice pathways are in place. And that's where we're going, I think, with the Commission and how it wants to manage complaints, but also what happens at the local level, because we want it resolved locally. But that's about having a framework there that is open, that actually says we've stuffed up and we can do better. And that was one of the things I looked at. How do we rebuild that trust when things go wrong? And that's what the leadership team can do. It's what are we apologising for? Why are we doing it? Because we realise it's had an impact on you. Having that empathy to say, if that happened to me, I would feel the same way as you did. And here's the plan of how we're going to do it better. So this is a believable plan, not promising the world, but this is how we're going to do better next time. And people want to hear that. How is it going to be prevented so someone else doesn't have this same experience of that? That's the leadership stuff that the governing body, but the local management can put in place as well.
You're right, Craig, that's absolutely critical, because we know if people's experiences are denied, it has such a negative impact for them, but it is more likely to result in unpleasantness and difficulty and ongoing difficulties. If you can acknowledge someone's experience, accept responsibility, and I hear from some individuals who've got services that as soon as it's acknowledged that there was an issue, yes, that did happen, we're very sorry that happened to you, they can move on to have a different kind of conversation about what might need to happen as a result.
Okay. I want to take us to personal agency for older people and the possibilities of cultivating that, because some people are naturally different, and we've already talked about the power imbalance. But I'm interested to hear your views on the training opportunities there and whether providers might actively lean into that space to elicit the feedback in a comfortable, safe environment by privileging the concerned voice. But before we get there, you can think on that question. I'd like to invite in those who are watching online and those in the room. Now, my monitor says there isn't a single question, so either you've been particularly slack or the monitor's not working. So I will need to be guided one way or t'other. But there doesn't appear to be any question yet that you have raised. So the invitation is there. Please feel free, because I genuinely want to hear what you have to think about.
There they
monitor is not working. I'll just get rid of this. All right. Is the video compiled by OPAN and COTA publicly available for providers to utilise with their teams? Craig.
I'm just looking directly at my manager of strategic engagement, and I think that we will release the video that because I think it's powerful voices that we want to get out there, particularly as we move forward with the new Aged Care Act, the rights-based. Going to your question, Janet, about privileging the person, I think this is why we think it's so important that supported decision-making is actually put into the Act. And providers often tell me, and they say, it's really difficult with families. And it's really challenging negotiating that family dynamic, which is often broken down. Supported decision-making actually privileges the older person's views more than it does the family. And it says to them, you've got to work it out. You've got to work it out early. You've got to document what the wishes and preferences are. Family member, you're in a really privileged position to do that. And putting that into the Act balances again the power dynamic for the older person, keeping them at the front and centre, even with their family. And that's going to help providers. But we're going to have to train providers, we're going to have to train family members in what that looks like. And, hey, it's my decision, respect my decision.
And Craig mentioned something about documenting wishes. That's interesting. Moving on. We talk about ageism, but I question the use of labelling people as older people, Michelle says. We interviewed over 130 of our residents. 75% stated older person does not describe them at all and felt offended that they are labelled old.
Yes.
Pat, do you want to start?
I think that's true. And I think that in a way, it's what am I trying to say? In a way, that's almost what we have to change a little bit. There's nothing wrong with being 60 or 70 or 80. I think, we've lived in a culture where to be younger is much, much better. And so people don't like to, and you can see it with advertising, if you want to get someone who's 60, you advertise with someone who's, 40. People identify as younger. So I totally believe that's the experience that they've had. And it's great that people feel that way. And it's not that I want people to sort of feel old, but I think there is a sort of a squeamishness about getting older. And, I would say that's part of my internalized ageism. I still, colour my hair because I got told once that grey-haired ladies don't get listened to. And the more that we invest in those patterns, the more we kind of reinforce them. So I totally think that that's right. And it's not about me saying I want people to think that they're old, but it is about saying what we all need to do is claim whatever age we are, and be proud and be ourselves and not try to be 20 or 30 years younger.
Okay, I might move us on. Dennis is taking us to the question of language and the use of the word consumer, which is it going to feature in the new Act, and what that implies, change to the noun, to the resident, to emphasise that it is their home. I don't believe we use the word resident in the new Act, although I'll look towards Michael and his team for clarification. My understanding is we're using older person, which goes to the question we just answered. We certainly have had very mixed views expressed about consumer, and I think generally towards the negative. It worked for a while, but I think it seemed to subtly objectify the individual in a way which was quite counterproductive. So my understanding is older person is the preferred language, and I think that's neutral. As Pat just said, and it kind of backs into her answer, we need to get over the implied prejudice that is attached to the word older, understand it as a person who happens to be in a particular age group, move on. I heard a wonderful linguist talking about the fact that we need to reclaim the word old.
Yes, and keep it focused on person, whatever that is.
Yeah.
Participant. We've seen the difference this makes in disability and some of the rights-based approaches that has started. It's not perfect in disability, but it has shifted about where that person is felt within the dynamic and the relationship of support and care.
Right. Okay.
Consumers also seem to be very market-based. And I think that the big shift in talking to older people over the last, good few years now is that they're saying if they want relational care, consumer doesn't really fit with that relational care. It is about people and individuals.
All right. We've got a question about reablement, but I think, Tim, you've framed it in a very interesting way. Let's go into it. Reablement is an essential component of independence, but so many older people don't choose this service. What do workers and providers need to do to increase participation? So we know in general that reablement is a really good idea and assist people to sometimes recover lost function, particularly if they've had a period of illness, and especially if they've been in hospital for even a brief spell where they come back with reduced muscle tone and all sorts of things which can be recovered if you take it very seriously. But what Tim's saying is we're not getting a high level of pickup. This is a really interesting framing of the question, because it's about what we know and our expertise that something will make a difference, but what the individual is deciding for themselves, possibly with less information. Craig, what do you do about that?
Yeah, and Mona, who was on our reference group and had said, no, this is not just about maintaining that. I'm at this level and I want the choice to be able to stay at this level as well. Again, the conversation about whether this is, I should be running more and doing more exercise as well. So it's also to us as well. What is the benefit of it? You feel better, that sort of thing. You might engage more in the community. So it's selling the benefit, that sort of thing, but also respecting choice or finding small ways that this was done that is actually acceptable to the person. Again, it's not the one size fits all. And I think that's trying to work and say the tail of it. What would work for you? What is your priority in life? Is it just maintaining function, or is it being able to get out to the shops more, which we can help you to do?
Yeah.
Reablement doesn't sound like something that you'd really like to have done to you, does it? I don't know that I'd want to be reabled. So I think it is, and I'm sure that people break that down, but it's not an instantly appealing kind of word to me. I mean, what does it mean? So I think talking about it in the way that people would understand what it means, and as Craig's saying, for something that matters to them. So, you know, a great example, I do remember when I was first learning about what reablement was, and I still didn't think it was a great term then, but was about somebody who really liked going to the letterbox to pick up their letters and having a chat with the post office. And they started with that really small goal. You know, what we're going to do is just help you so that you feel confident to be able to walk to your letterbox. So, you know, picking something that matters to the person. Because if you think about it, most people want to stay at home because they want to maintain their independence. They want to be able to do those things. And I'm sure people in residential care have those goals as well. But that's what I hear older people expressing. I want to continue to be able to do this for myself. Maybe not, you know, I'd be happy to give up my cleaning. I mean, I get that thing. But, you know, majority when you're talking to someone older, they actually talk about how they want to keep their agency, how they want to keep their independence. And I think working with that and picking things that really are meaningful to that person would possibly help with that situation.
Yeah, very useful. Okay, I want to get through a couple more questions if we can. There are lots here, and obviously we're not going to get through all of them, but we will absolutely take them on board and ensure that our information back to the wider group of providers is informed by these sort of interests. So the next one is, and Aidan's asked it, what's the best way, in your opinion, to definitively shift staff mindset away from transactional care to person-centred relational care, whilst noting the high number of tasks they need to do each day? Now, this is a familiar concept. This is absolutely where you are, because you know there's a certain amount you need to get done in each shift, and there's no excess time which is available. My view on this is magic moments, which is that every single interaction that is had with an individual, an older person receiving care, by whomever is passing them, is a potential moment of joy. Craig, do you have a view on this?
Yeah, I think it is the moments. I think it might have been Julia or someone spoke yesterday about not seeing the plate that's sitting in someone, not seeing not seeing the funding source that's coming in attached to this person. It's about them having those incidental conversations, but it is a program of work. I want us to all work together on this as we build the implementation and operationalising the statement of rights. We need to work together on this because it's going to have to be, how do we embed this into our daily practice, as opposed to bang, this is your half hour for have your rights upheld, the rest of the day we go to transaction. No, it's going to have to come into our DNA and our relationships.
Yeah. Let me move on.
Can I just add too,
briefly,
it's not going to just be about moments of joy. It's going to be about moments of sadness and moments of depression, and people actually being able to talk about those things. And I think, you know, it is a big cultural shift and change, and it will make some people uncomfortable, I suspect, but agree with Craig, and there has to be, training and support and a real mindfulness at all levels of the organisation about the shift and the change that's occurring.
Okay, possibly the last question. We'll see how we go, but I'm very keen to take us here. What are we doing to ensure that people with dementia are getting the best care? Now, each of you, and I'll invite you to make this a closing comment, has a perspective on people who aren't as well placed to express their own views, to exercise choice independently for themselves, who rely on others who may or may not be in their lives. What do we do about that in terms of a rights-based act and the expectations we've articulated this morning?
Yeah, and I think we're really looking forward to the National Dementia Action Plan also considering human rights of people living with dementia in that as well. Partly it's making sure the supports are in place, making sure that we've got the supported decision-making framework in place, making sure we're engaging our aged care advocates to come and work with the person and to be there at those times, because that's a protective mechanism to make sure their rights are upheld. It's also documented early, because Teresa Flavin, who's a staunch advocate, went to the UN last year. First time lived experience was represented at the UN on the rights of older people, but talked about, I want an advanced social directive. I want my voice documented. Interview me now so it's known what I want in the future. And I think that's the power, to have that voice of the person themselves. Yes, we need to do better in this area, but that's the key to supported decision making, to hold their voice, know what that person wants.
That's very powerful. Pat.
I think that is really important, but I think it's also, so I would agree with that. And obviously, at different stages, it's very difficult, but it's also about being with where the person is at and not assuming that because they have dementia, which I think has been an assumption in the past, that a person has dementia, they actually can't contribute to the decision making, or they can't have a say. And I think that, we've got to shift that. And perhaps just a personal experience to share it with. I had a father who had dementia and an auntie who had dementia, and witnessed a beautiful moment between them. They didn't really know who the other person was. They didn't remember, but they were sharing fruit, and they knew that that person was someone important to them. They were actually feeding each other fruit. We were all sitting there with my sisters and my cousin actually, and we were crying, because in that moment you could see that they actually did know who they were to each other in some way, although they couldn't express it in that way. So I think actually making sure that the voice is recorded, but also seeing where the individual is and going with where they are as well, and accepting that it may not be presented in the same way as you or I might present it if we don't have dementia, but they are still able to have their say and communicate in many ways what it is that they want and what they're feeling, and that we need to always listen. And I'm reminded of, hearing that horrible statistic. It was a few years ago now, and I hope it's much, much lower, that, some of the behaviours that people with dementia had was undiagnosed pain. So, I mean, it goes back to asking questions, listening, and being with where the person's at, so that you're picking up all of those clues and not missing important details that you need to be aware of.
Thank you, Pat. And that brings us to a close for this session. Thank you, all of you who participated and contributed so strongly to the questions. As I said earlier, we will gather those up and make sure that they inform our communications from here on. My particular thanks to Craig and Pat. I have it on advice that it's Craig's birthday today. So happy birthday, Craig. And I think this has served us a treat, and it certainly allows us to think about all of these things as we go into the following sessions. So thank you both, and thank you for being so giving and thoughtful in the contributions you've made and that you continue to make. I'll hand you back to Richard briefly for some housekeeping before we break. Richard.